Walking seems like the simplest thing we do. One foot in front of the other. We've been doing it since childhood without thinking twice. But what if I told you that how you walk could reveal critical information about what's happening inside your brain? According to recent research from the Journal of the American Geriatric Society, changes in walking patterns can predict dementia diagnosis years before memory symptoms appear. For people over 65, these walking changes aren't just about getting older or having arthritis. They're often early warning signs of vascular dementia, the second most common form of dementia after Alzheimer's disease. What shocked me when I researched this topic is that most people, and even some doctors, completely miss these walking-related symptoms. They dismiss them as normal aging, when they're actually red flags that the brain isn't getting adequate blood flow. Vascular dementia occurs when blood flow to the brain becomes restricted, usually due to small strokes or damaged blood vessels. These changes affect specific brain regions that control movement and coordination, creating distinct walking patterns that trained observers can recognize. In this video, I'll reveal 7 vascular dementia symptoms that show up specifically in how you walk. Sign number 3 is so subtle that even family members living in the same house miss it completely. Yet, it's one of the most reliable early indicators that doctors look for. Before we start, I need to be crystal clear about something. This video is for educational awareness only. If you or someone you love shows any of these walking changes, you must speak with a doctor immediately. Only a medical professional can properly diagnose vascular dementia. These signs don't confirm anything by themselves, but they should prompt you to seek professional evaluation. Now, let's dive into the walking changes that could save someone's cognitive function if caught early. Sign number 7. Walking speed slows noticeably, especially when multitasking. This isn't about walking slower because your knees hurt or you're tired. We're talking about a specific pattern where walking speed decreases dramatically when you're trying to do 2 things at once. Here's why this happens. Walking requires more brain power than most people realize. Your brain must coordinate muscle movements, maintain balance, process visual information, and plan your path forward, all simultaneously. When vascular dementia begins affecting the brain, this multitasking ability deteriorates significantly. A groundbreaking study from the University of Toronto followed over 4,000 adults over 65 for 5 years. They discovered something remarkable. Changes in walking speed predicted dementia diagnosis years before memory symptoms appeared. People who developed vascular dementia showed slower walking speeds an average of 3 years before diagnosis. The mechanism involves the brain's executive function, controlled primarily by the frontal lobes. When small strokes damage these regions, the brain struggles to handle multiple tasks simultaneously. Walking while talking, walking while carrying something, or walking while thinking about where you're going becomes noticeably more difficult. You might observe someone who walks at a reasonable pace when focused solely on walking, but ask them a question while walking and their speed drops dramatically. They might even stop walking completely to answer. This is called dual task interference, and it's a hallmark of vascular cognitive impairment. What makes this sign easy to miss is that the person can still walk normally when that's their only focus. Family members don't notice a problem because they see their loved one walking fine around the house. They don't realize that walking speed plummets when mental demands increase. If you notice someone over 65 whose walking speed varies dramatically depending on whether they're distracted or talking, document this pattern. Note specific situations where walking slows significantly. This information helps doctors assess whether vascular changes are affecting brain function. Sign number 6. Taking noticeably shorter steps without realizing it. The person begins taking shorter steps without any awareness that their stride has changed. This happens gradually over months, making it easy to miss unless you're specifically watching for it. Here's why this happens. Stride length is controlled by brain regions that plan and execute movement. When vascular dementia affects these areas, particularly the basal ganglia and frontal lobes, the brain's ability to generate normal length steps deteriorates. Research published in Neurology found that stride length reduction is one of the earliest measurable changes in people developing vascular dementia. The study showed that each centimeter decrease in stride length correlated with increased dementia risk. The mechanism involves disrupted signals between the brain and leg muscles. The brain knows it wants to take a normal step, but the signals controlling step length become impaired. The person unconsciously compensates by taking shorter, more cautious steps. You might notice someone who used to walk confidently with long strides now takes small, shuffling steps. The change isn't due to pain or weakness. Their legs work fine, but their brain can't coordinate normal stride length anymore. What makes this particularly significant is that the person usually has no awareness of the change. If you ask them if they're taking shorter steps, they often deny it or seem surprised. This lack of awareness is itself a symptom, indicating that the brain regions monitoring movements have been affected. The shortened stride creates a distinctive appearance. Instead of the heel-to-toe roll of normal walking, the feet barely lift off the ground. Steps become more frequent but cover less distance. Walking looks effortful, even on flat, clear surfaces. If you notice stride length decreasing in someone over 65, particularly if they're unaware of the change, measure the actual stride length if possible. Have them walk normally and measure the distance from one heel strike to the next heel strike of the same foot. Normal stride length is roughly equal to height, so someone 5'1.5" tall should have a stride around 5.5 feet. Significant reduction requires medical evaluation. Sign number 4. Increased difficulty turning or changing direction. Turning while walking should be smooth and automatic, but in vascular dementia, turning becomes noticeably difficult and sometimes dangerous. The person might take several small steps to complete a turn, pause before turning, or become unsteady when changing direction. Here's why this happens. Turning requires complex coordination between multiple brain systems. Your brain must process spatial information about where you want to go, plan the turning movement, shift your weight appropriately, and maintain balance throughout the turn. When vascular dementia damages the brain regions controlling these functions, turning becomes problematic. Studies show that turning difficulty appears early in vascular dementia, often before obvious memory symptoms appear. Research from the Gait and Brain Lab found that people with vascular cognitive impairment took 30% longer to complete a 180-degree turn compared to healthy adults. The mechanism involves several affected brain regions. The parietal lobes process spatial information about your body's position and orientation. The basal ganglia coordinate the sequential movements needed for turning. The cerebellum maintains balance during direction changes. When small strokes damage these areas, the coordinated action of turning falls apart. You might observe someone who walks straight ahead reasonably well, but becomes noticeably unsteady when turning. They might pause, grab furniture or walls for support, or take several small shuffling steps to complete a simple turn. Some people develop a pattern of turning their entire body as one rigid unit, rather than the normal smooth pivoting motion. What makes this sign easy to miss is that most walking happens in straight lines. Family members don't pay attention to the few times daily when turning occurs. But healthcare providers specifically test turning ability because it reveals brain function problems that straight line walking might hide. If you notice turning difficulties in someone over 65, document specific situations that cause turning. Note whether they need support, how many steps a turn requires, and whether they seem unsteady. This information provides valuable diagnostic clues about which brain regions may be affected. Sign number 4. Hesitation before stepping off curbs or through doorways. This symptom appears as noticeable hesitation or uncertainty before stepping up, stepping down, or walking through doorways. The person might pause, seem to calculate the movement, or need to hold on to something before proceeding. Here's why this happens. Stepping onto different surfaces or through openings requires your brain to judge distance, height, and spatial relationships accurately. When vascular dementia affects the visual spatial processing centers in the brain, particularly in the parietal and occipital lobes, this ability deteriorates. Research shows that visual spatial problems appear in approximately 40% of vascular dementia patients, often before obvious memory symptoms. These problems make activities involving depth perception and spatial judgment increasingly difficult and anxiety-provoking. The mechanism involves impaired processing of visual information about three-dimensional space. The person's eyes see the curb or doorway clearly, but their brain can't accurately interpret the height of the step or the width of the opening. This creates uncertainty and hesitation. You might observe someone approaching a curb and stopping completely, seeming to study it before attempting to step up or down. They might reach for support even on small curbs that shouldn't require it. Walking through doorways becomes problematic as they misjudge the opening width and sometimes bump into the frame. What makes this sign particularly dangerous is the fall risk it creates. Hesitation at curbs or steps disrupts the normal rhythm of walking. The person might misjudge and step too soon or too late, leading to stumbles or falls. Their uncertainty makes them move more slowly and tentatively, which paradoxically increases instability. The psychological impact is also significant. As the person becomes aware that curbs and steps are challenging, they develop anxiety about these situations. This anxiety can lead to avoiding walking outdoors or in unfamiliar environments, reducing overall activity and social engagement. If you notice hesitation before steps, curbs, or doorways in someone over 65, this warrants medical evaluation. Document specific situations that cause hesitation and whether the person requires support or multiple attempts to navigate these obstacles. Sign number 3. Walking becomes increasingly unsteady, particularly when turning or in dim lighting. This is a sign that almost everyone misses completely, yet it's one of the most telling indicators of vascular dementia. The person's walking steadiness varies dramatically based on circumstances. They might walk reasonably well in bright light on familiar straight paths, but become noticeably unsteady when turning, in dim lighting or on unfamiliar surfaces. Here's why this happens. Balance during walking depends on 3 sensory systems working together: vision, inner ear balance organs, and position sensors in muscles and joints called proprioception. Your brain integrates information from all 3 systems to maintain steady walking. When vascular dementia affects the brain regions that process and integrate this sensory information, particularly the cerebellum and parietal lobes, balance becomes unreliable. The critical insight is that the brain compensates for weakness in one system by relying more heavily on the others. When someone has vascular dementia affecting their brain's balance centers, they unconsciously depend more on visual cues to stay steady. In bright light with clear visual references, they manage reasonably well. But reduce the lighting and suddenly they become unsteady because their brain can't compensate for the damaged balance processing centers without strong visual input. Research from the Journal of Neurology shows that this variable balance, worse in challenging conditions, is highly specific to vascular dementia compared to other causes of walking problems. Orthopedic issues like arthritis don't improve with better lighting, but vascular cognitive impairment does because the problem is in the brain's processing, not the legs themselves. You might observe someone who walks confidently during the day but becomes noticeably unsteady at night or in dimly lit rooms. They might stumble more frequently when turning, even if straight-line walking seems fine. Uneven surfaces like grass or gravel that require constant balance adjustments become particularly challenging. What makes this sign so easy to miss is that the variability seems to confirm it's not a brain problem. Family members think if it was really dementia, they'd be unsteady all the time. But the opposite is true. This specific pattern of variable steadiness, worse with reduced visual input or increased complexity, indicates that the brain can't integrate sensory information properly anymore. The person might not recognize this pattern themselves. They know they feel less steady sometimes, but can't identify the specific triggers. They might avoid evening activities or dark environments without consciously understanding why. If you notice that someone over 65 is significantly less steady in certain conditions, particularly dim lighting or when turning, this specific pattern requires neurological evaluation. Document when steadiness is better versus worse. This information helps doctors distinguish vascular dementia from other walking problems. Sign number 2. Shuffling gait where feet barely lift off the ground. Instead of the normal heel-to-toe walking pattern where each foot lifts clearly off the ground, the person begins shuffling with feet barely clearing the floor. This creates a distinctive scraping or sliding sound and appearance. Here's why this happens. Normal walking involves a complex sequence where you lift your foot, swing it forward, and place the heel down first before rolling onto the toe. This requires precise coordination between brain regions that plan movement, execute it, and monitor its success. When vascular dementia damages these coordinating centers, particularly through small strokes in the basal ganglia or frontal lobes, the brain loses its ability to generate normal lifting movements. The feet remain closer to the ground throughout the walking cycle. The mechanism is called gait apraxia. The brain knows what it wants the feet to do, but can't send clear, coordinated signals to make it happen smoothly. The result is a shuffling pattern where minimal foot lift occurs. Research shows that shuffling gait significantly increases fall risk. Because the feet barely clear the ground, small obstacles like rug edges, uneven pavement, or slight inclines cause tripping. The person can't respond quickly enough to prevent falls because their brain's movement control centers are already impaired. You might observe someone whose feet slide along the floor rather than lifting with each step. The pattern is often more pronounced when tired or distracted. They might trip over small objects that wouldn't affect someone with normal foot clearance. What makes this sign particularly concerning is that people often attribute shuffling to weakness or fatigue rather than recognizing it as a neurological symptom. They might say their legs feel heavy or tired, not realizing the problem is in their brain's movement control centers. The shuffling also tends to worsen gradually. It might start as slightly reduced foot lift and progress over months to pronounced shuffling. Family members adapt to the change without recognizing its significance. If you notice shuffling gait developing in someone over 65, particularly if it's progressive, document how severely the feet fail to lift and whether tripping is becoming more frequent. This symptom requires medical evaluation, including neurological assessment. Sign number 1. Freezing episodes where walking suddenly stops. Perhaps the most distinctive and concerning walking symptom in vascular dementia is freezing. The person is walking along normally, then suddenly their feet seem stuck to the ground. They can't initiate the next step despite clearly wanting to move forward. The episode might last seconds or longer before walking resumes. Here's why this happens. Walking initiation and continuation require continuous signals from the brain's motor control centers to the legs. When vascular dementia affects the circuits connecting the basal ganglia and frontal lobes, these continuous signals become disrupted. The result is intermittent freezing, where the motor program for walking temporarily fails. Research shows that freezing episodes are particularly common in vascular dementia compared to Alzheimer's disease. A study in movement disorders found that freezing occurred in approximately 25% of vascular dementia patients, but only 7% of Alzheimer's patients at similar disease stages. The mechanism involves specific damage to brain circuits that maintain rhythmic walking movements. Small strokes in the basal ganglia disrupt the neural loops that keep walking flowing smoothly. The brain tries to send the walk command, but the circuits fail to transmit it effectively to the legs. Freezing episodes often occur in specific situations. Turning is a common trigger. Walking through doorways frequently causes freezing, a phenomenon called doorway freezing. Starting to walk after standing still can be difficult. Stressful or hurried situations worsen freezing. You might observe someone walking normally who suddenly stops, appearing stuck. Their upper body might continue to lean forward while their feet remain planted. They might take several small shuffling steps in place before walking resumes. Some people develop strategies like stepping over an imaginary line or counting to restart walking. What makes this sign particularly dangerous is the fall risk. When freezing occurs unexpectedly, particularly while turning or in doorways, the upper body's forward momentum combined with stuck feet create high risk for falling forward. The person can't catch themselves because their feet won't move. Freezing also creates significant anxiety. Once someone has experienced freezing episodes, they become fearful of walking, particularly in situations where freezing commonly occurs. This fear leads to reduced activity and social isolation. If you notice freezing episodes in someone over 65, this requires urgent neurological evaluation. Document when freezing occurs, how long episodes last, and what helps them resolve. This symptom indicates specific brain circuit damage that may respond to treatment if addressed promptly. What you must do next. If you recognize multiple walking changes in yourself or someone you love, don't panic, but don't delay either. These walking changes indicate that the brain isn't functioning optimally, and early intervention can make significant difference. First, document everything. Use your phone to video the person walking in different situations: walking while talking, walking in bright versus dim light, turning, going through doorways, and navigating steps. These videos provide objective evidence that helps doctors understand what's happening. Second, note specific examples of each walking change you've observed. When did you first notice it? How often does it occur? What situations make it better or worse? Has it been getting progressively worse? This detailed information helps doctors assess progression and severity. Third, schedule a comprehensive evaluation with a neurologist or geriatric specialist immediately. Don't wait for walking problems to worsen. Don't let primary care doctors dismiss changes as normal aging without thorough investigation. Insist on complete neurological assessment, including cognitive testing and brain imaging. Fourth, while waiting for your appointment, focus on safety. Improve lighting throughout the home. Remove tripping hazards like loose rugs. Install grab bars in bathrooms. Consider using a walking aid if steadiness is significantly impaired. These measures prevent falls while awaiting diagnosis. Fifth, understand that vascular dementia differs from Alzheimer's disease in one critical way. The underlying cause is vascular, meaning blood vessel problems. When doctors address these vascular issues early through blood pressure control, diabetes management, cholesterol treatment, and stroke prevention, they can often prevent or significantly slow cognitive decline. Remember, these walking changes aren't just mobility problems. They're windows into what's happening inside the brain. Walking is controlled by multiple brain regions, and changes in walking patterns reveal which areas are being affected by reduced blood flow. Finally, maintain hope. Vascular dementia, particularly if caught early through recognition of these walking symptoms, is more manageable than many people realize. Proper vascular risk management can prevent further strokes and preserve cognitive function. Rehabilitation can improve walking safety and reduce fall risk. Which of these 7 walking signs surprised you most? Have you noticed any of these changes in yourself or someone you love? What questions do you have about vascular dementia and walking? Share your thoughts in the comments below. Your experience might help someone else recognize important warning signs. If this information helped you understand the connection between walking and brain health, please like this video and subscribe to our channel. We create evidence-based health content specifically for people over 65 and their families. Share this video with anyone who needs this information. Early recognition of these walking changes can literally prevent falls, preserve independence, and slow cognitive decline. Remember, knowledge is power, but only when you act on it. If you recognize multiple walking changes, make that doctor's appointment today. Your brain health and safety are worth protecting.